Hey guys, welcome back to our channel Nutrition Media, where we cover different health-related topics, so we together can live a healthy life. And so, in this video, we are going to talk about alopecia areata. So let's start the video. Alopecia areata is an autoimmune disorder that causes your hair to come out, often in clumps the size and shape of a quarter. The amount of hair loss is different in everyone. Some people lose it only in a few spots. Others lose a lot. Sometimes, hair grows back but falls out again later. In others, hair grows back for good. It affects roughly 6.8 million people in the United States and 147 million people worldwide. In most cases, hair falls out in small patches around the size of a quarter. There may be only a few patches, but alopecia areata can affect wider areas of the scalp. If there is a complete loss of hair on the scalp, doctors diagnose alopecia totalis. If there is hair loss throughout the entire body, the condition is called alopecia universalis. Alopecia can affect anyone, regardless of age, gender, or race, though most cases develop before the age of 30. In this article, we look at the causes and symptoms of alopecia areata, its diagnosis, and potential treatments. Let's have a look on the treatments of alopecia areata. There is currently no cure for alopecia areata, although there are some forms of treatment that can be suggested by doctors to help hair regrow more quickly. The most common form of alopecia areata treatment is the use of corticosteroids, powerful anti-inflammatory drugs that can suppress the immune system. These are mostly commonly administered through local injections, topical ointment application, or orally. Other medications that can be prescribed that either promote hair growth or affect the immune system include minoxidil and anthraline. Although some of these may help with the regrowth of hair, they cannot prevent the formation of new bald patches. In addition to its aesthetic aspect, hair affords a degree of protection against the elements. People with alopecia areata who miss the protective qualities of hair may wish to wear sunscreen if exposed to the sun. Wear wraparound glasses to protect the eyes from the sun and debris which the eyebrows and eyelashes would normally defend against. Use headwear such as hats, wigs, and scarves to protect the head from the sun or keep it warm. Use ointment inside the nose to keep membranes moist and to protect against organisms that are normally trapped by nostril hair. Alopecia areata does not directly make people sick, nor is it contagious. It can, however, be difficult to adapt to emotionally. For many people, alopecia areata is a traumatic disease that warrants treatment addressing the emotional aspect of hair loss, as well as the hair loss itself. Support groups and counseling are available for people to share their thoughts and feelings and to discuss common psychological reactions to the condition. Some have compared alopecia areata to vitiligo, an autoimmune skin disease in which the body attacks melanin-producing cells, leading to white patches. Research suggests that these two conditions may share a similar pathogenesis, with similar types of immune cells and cytokines driving the diseases and common genetic risk factors. As such, any new developments in the treatment or prevention of either disease may have consequences for the other trusted source. There have been a handful of documented cases where treatment for alopecia areata using diphenhydramine, a contact sensitizer, has led to the development of vitiligo. Preliminary research in animals has found that quercetin, an naturally occurring bioflavonoid found in fruits and vegetables, can protect against the development of alopecia areata and effectively treat the existing hair loss. So what are the most common causes of alopecia areata? The condition occurs when white blood cells attack the cells in hair follicles, causing them to shrink and dramatically slow down hair production. It is unknown precisely what causes the body's immune system to target hair follicles in this way. While scientists are unsure why these changes occur, it seems that genetics are involved, as alopecia areata is more likely to occur in a person who has a close family member with the disease. 1 in 5 people with the disease has a family member who has also developed alopecia areata. Other research has found that many people with a family history of alopecia areata also have a personal or family history of other autoimmune disorders, such as atopy, a disorder characterized by a tendency to be hyperallergic, thyroiditis, and vitiligo. Despite what many people think, there is very little scientific evidence to support the view that alopecia areata is caused by stress. Extreme cases of stress could potentially trigger the condition, but most recent research points toward a genetic cause. Research on ethnicity and race. In the past, people believed that alopecia areata occurred equal a trusted source across all races, but more recent studies suggest that this may not be true. For example, some findings suggest its source that African Americans and Hispanic females have a greater lifetime occurrence of the condition when compared with white females. Additionally, there is a low risk in Asian people compared with white people. According to a 2019 study based on an analysis of over 11,000 cases in the National Alopecia Areata Registry between 2000 and 2016, the odds ratios of an alopecia areata diagnosis for people of color when compared to white people: 1.77 for African American people, 1.27 for other races, including Native Americans and Pacific Islander people, 1 for white people, 0.9 for Hispanic people, 0.4 for Asian people. Based on a 2018 cross-sectional analysis from the Nurses Health Study and Nurses Health Study 2 of over 1,100 women who reported a diagnosis of alopecia areata, compared to 1.00 odds for white women, the odds for a diagnosis for black women were 2.72 per the NHS and 5.48 per the NHSII. For Hispanic women, the odds were 1.94 compared to white women. There were no significant incidence differences based on the NHS, but only a few studies have examined the patterns and determinants of alopecia, and pathophysiological factors are largely unexplored. Further research is warranted that takes into consideration environmental, behavioral, genetic, and socioeconomic factors as well as access to health care. Following are the symptoms of alopecia areata. The most prominent symptom of alopecia areata is patchy hair loss. Coin-sized patches of hair begin to fall out, mainly from the scalp. Any side of hair growth may be affected, though, including the beard and eyelashes. The loss of hair can be sudden, developing in just a few days or over a period of a few weeks. There may be itching or burning in the area before hair loss. The hair follicles are not destroyed, and so hair can regrow if the inflammation of the follicle subsides. People who experience just a few patches of hair loss often have a spontaneous, full recovery without any form of treatment. About 30% of individuals who develop alopecia areata find that their condition either becomes more extensive or becomes a continuous cycle of hair loss and regrowth. About half of patients recover from alopecia areata within 1 year, but many will experience more than one episode. Around 10% of people will go on to develop alopecia totalis or alopecia universalis. Alopecia areata can also affect the fingernails and toenails, and sometimes these changes are the first sign that the condition is developing. There are a number of small changes that can occur to nails. Pinpoint dents appear, white spots and lines appear, nails become rough, nails lose their shine, nails become thin and split. Additional clinical signs include exclamation mark hairs. This occurs when few short hairs that get narrower at their bottom and grow in or around the edges of bald spots. Cadaver hairs. This is where hairs break before reaching the skin surface. White hair. This may grow in areas affected by hair loss. Doctors are usually able to diagnose alopecia areata fairly easily by examining symptoms. They might look at the degree of hair loss and examine hairs from affected areas under a microscope. If, after an initial clinical examination, the doctor is not able to make a diagnosis, they can perform a skin biopsy. If they need to rule out other autoimmune diseases, they might perform a blood test. As the symptoms of alopecia areata are so distinctive, making a diagnosis is usually quick and straightforward. So, that was it for today's video. If you have any other questions related to alopecia areata, you can comment in the comment section below and let us know about your queries. Also, if this video was helpful, make sure to like the video and subscribe to our channel. And click that bell icon for more videos like that. See you in the next video.